Al, welcome to the show.
Yeah, thank you for having me. Excited.
You were just telling me that, how do you think COVID changed the healthcare industry?
Yeah, I think one of the more fascinating things about COVID is, so we started the company before COVID, 2017, and around that time we were maybe 10 or so customers, and at that time we would get customer calls like, "Hey, the guy that's booking me appointments, could you please tell him to change the color to yellow or red or whatever?" Like, as in, they're thinking like it's an actual human booking appointments in their system, and not an automated software.
They didn't even realize that you had made software.
Exactly. So like, the end users are like actually that far from being tech savvy, basically.
Wow.
COVID hits, and all of a sudden, are they not only tech savvy, but they actually care about, amazing UX and user experience and things being on the cloud and mobile and easy to use. And then, right after you get AI, and with AI, we have this very same ICP, right? That's not very technical and so on, but their evolution has, in terms of tech literacy, has changed so much that they're able to, they take our API and build their own solutions.
Really?
Yeah. So I want to say, since from COVID to today, what is that, like roughly 5 years, right?
Depending on how long you engage COVID, like, I mean, sometimes I feel like COVID started yesterday. Honestly, like one of those things, like you go in, you're like, holy shit, it's almost 2027 now.
Yeah. Anyways, I think, obviously it was a lot of bad things happened to the world, especially in the world of healthcare, right?
Oh, yeah.
At the same time, though, some of the positives would be, I think, the industry probably went through 30 years of transformation.
Really?
Yeah, in just like 5 years or so. Yep.
So when you say the industry, you work with kind of smaller, independent-ish,
Yep,
like local doctors. When you think of like a local business, like a dentist, I think dentistry, you started with dentists. So who is your customer? Like what do they look like?
Yeah, so I would say we have 3 types of customer profiles. So the first and primary one that we got started with as a company and our initial wedge, it would be your local dental office. As of today, though, I want to say, so it's your local dental office, your local dermatology office, and so on. Along with it, there's a private equity roll-ups. So, you can think of KKR comes in and they roll up, the largest dental roll-up is owned by them, 2,000 offices and so on, right?
Oh,
so that's the type of customer that we have. And the third and final one would be developers and innovators in the space, where they use our API to build innovative solutions that can actually action data in the real world. Meaning, if you're a YC startup, right, and you're building any sort of a product, like a phone agent, like an AI phone agent, right? And you're selling it to practices. Whenever you as a consumer, call that practice, and your AI agent picks it up, right? That AI agent needs to actually know information about you as a consumer, right?
Yep.
And NexHealth is the connector, very, very similar to Plaid, where these developers are building on top. And our own SaaS product is actually built on top of that same API. So yeah, anyways, we have, generally speaking, honestly, like these 3 types of customers: private equity roll-ups, independent offices, and then developers that also build for them.
Interesting. Yeah. Okay. And then I think you were telling me that there's, I think it's something like 700,000 kind of independent practices across the country. I think the number is 80% of them still have or had until recently literal like servers in the closet to like power the business. So like, why was that the case?
Yeah, so I mean, today I would say if you look at the dental industry, right, like 75% is still on-prem.
Really?
If you look at the medical industry, I want to say 50% is on-prem, which is dramatically different than what it used to be 5 years ago. 5 years ago, I would say majority 80 to 90% was actually on-prem.
Okay.
But the reason, the world of on-prem and the reason, our customers, like, your local dental office, right?
Yep.
You go there, there's, high chance that they actually have a server somewhere in the office where, the desk computers that they're using, it's actually server client setup, and there's an IT managing it to this day and so on. The why behind it, I think, is, twofold. One is some of it is just like legacy, as in a lot of these offices, they digitized in the early 2000s or 90s. And at that time, those were the options available to them. And then modernization of that same software. Doesn't generally happen for, I want to say, two reasons. One is change management, as in, migrating your system of record is like really high risk for a lot of these offices.
Why is it so hard? Because these are basically like, it's like a doctor who got a master's degree, studied medicine for 10 years, and they have to then upgrade to the cloud. Like, is it just not really an option?
Twofold, actually. So one is most of these incumbents, they actually make it hard for you to migrate, first of all.
Really?
Yeah. So like, like if you're migrating, so you have this SQL database in the office that you own and you manage. You're not a technical, you're not a tech company. Like, why do you even have your own server, first of all, right? But that is
There's like a doctor that also, he's seeing patients. He's also managing his SQL server.
Exactly, right? So and then it's managed by a third party, right? And you have these records, stored in a certain format. So let's say you're going from software A to software B. The migration and the format of that migration of the data, right? And you can't lose that data either. It's patient data, right? You have your billing data, you have a lot of compliance needs behind it. And of course, you're serving patients, right? And their records. So any loss of that data and it not being compatible with the next system you're going with is just incredibly risky to them.
Really?
So most offices would rather not even take that risk.
I mean, can't you just back it up or something? Like, is that also hard?
That's possible. But here's the thing, what I would say, a lot of things that we expect in tech, right? So as an example, we use Salesforce as our system of record, and a lot of these tools, right? We expect Salesforce to provide us, right? Like, as an example, logging data or SSO and so on, right? In our space, at least historically, the vendors just don't provide those tools, either because of self-interest and or just, a bad product, let's say. And as a result of that, what ends up happening over time is the providers themselves, are sort of stuck on older systems, and they aren't able to upgrade. And even, let's say, when they try, they have to go through a ton of friction to do it. Mostly because the incumbents are actually very incentivized to keep you within their existing ecosystem and within, unless they're now selling you maybe a cloud version themselves, right?
Yep.
And we can get into why that is, but generally speaking, most electronic health record systems, their business model is really oriented around, maybe except for a few, I want to say, like Athena Health would be maybe an exception to this, but their business model is really oriented around making sure that migration of data, change management, or access to the office's data needs permission from the vendor themselves. For any office or any third party, right, to be able to innovate or adopt any tools.
This episode is brought to you by Numeral. Numeral is the fastest, easiest way to stay compliant with U.S. sales tax and global VAT. It's easy to set up, and they automatically handle all registrations, ongoing filings, and their API provides sales tax rates wherever you need them with all the integrations you need. Their solution combines AI-driven automation with human expertise to manage global sales tax compliance end-to-end. Numeral supports over 3,000 customers, including companies like Brex and Character AI, and they pride themselves on white-glove, high-touch customer service. Plus, they guarantee their work, and they'll cover the difference if they mess anything up. If you want to get compliant, check out Numeral at their new domain, numeral.com. That's numeral.com for the end-to-end platform for sales tax and VAT compliance. This episode is brought to you by Flex. It's the AI native private bank for business owners. I use Flex personally, and I love it because they use AI to underwrite the cash flow of your business, giving you a real credit line. The best part is 60 days of float, double the industry standard. Flex has all the features you'd expect from a modern financial platform, like unlimited cards, expense management, bill pay that syncs with your credit line, and their new consumer card, Flex Elite. Flex Elite is a brand new ramp-like experience for your personal life. A credit card with points, premium perks, concierge services, personal banking, cards and expense management for your family, net worth tracking across public and private assets, and a whole lot more fully integrated with your business spend. One card for your businesses, one card for your personal life, one card for everything. To skip the waitlist, head to flex.one and use my code Turner to get an additional 100,000 points worth $1,000 after spending your first $10,000 with Flex Elite. That's flex.one and code Turner for $1,000 on your first $10,000 of spend. Thank you, Flex. And now let's jump in.
So how does that impact like the rest of the industry?
Yeah, so healthcare data interoperability more generally it is one of the hot button topics of healthcare, and it has been since the 90s. The fascinating thing about this problem is that every federal government, like every decade or so, tries to pass some new regulation. So it was actually President Clinton first that passed regulation for open healthcare data, and then President Obama tried, and then Trump passed I think 2 different regulations around it. First term, and then second term.
No one did it again.
Yeah, exactly. So it's a big problem within the space. And what it basically means is this, right? So you and I, we go to doctor's offices. Majority of us were born in a hospital, and throughout our lives, we've gone to many different doctors, right? And for you as a consumer, you've generated all this health data. And if I were to ask you today, hey, Turner, where's XYZ prescription, or like, where's your health data, right? The more general answer you'd give is like, well, I don't really know, and or this is the doctor I go to, maybe they have it, right? And then if I were to ask you as a consumer, like, hey, how many healthcare apps do you have in your phone? Most consumers would probably just have Apple Health. Versus you look at the fintech space, right? On the other hand, like if I just went through your phone, you'd probably have like 4 to 5 fintech apps.
Oh, I probably have more than that.
Right?
Honestly.
Yeah.
There's a lot, yeah.
So there's a ton of innovation. As an example, I think where the healthcare space is today is probably where fintech was 10, 15 years ago. And there's a ton of comparisons and analogy that holds, where there's a ton of innovation happening for consumers and businesses on the fintech side, but not the healthcare side. And the reason is because the data interoperability problem, where every doctor's office has a different way of storing data. There are probably like 1,000 different electronic health record vendors out there across hospitals and the SMB retail space, right? And no one, generally speaking, has 3 to 5% market share. So that means like if you're a developer, right, and you're looking to build any sort of a healthcare data integrated product, either consumers or B2B, you either build like a very niche one, meaning like you're going to only serve the orthodontist, or you're going to only serve the dermatologist, and that's it.
Yep.
Or you really don't build anything that's actually truly healthcare data integrated, because then you'd have to go spend 9 months to years looking for partnership agreements with each and every one of these legacy vendors. And even if they do give you a partnership agreement, it's like, hey, give us 30% of your revenue or 50% of your revenue. And you can only have access to a very limited, 25% of the data that you actually need to build a good product. And then, you can only read data maybe like every 24 hours. And you can't write data. So that's like very limited either way. So,
Yeah,
so you end up
like that's like a terrible, why would you even say yes to that? I mean, I guess you probably have to, like there's no other options.
Yeah. So like if you're, even those niche players, just as an FYI that I referenced, right?
Yeah.
That is what they end up doing, right? So by default, they already operate within a niche space, right? Like either dentistry, let's say, or orthodontist, or dermatology. And even within that niche space, right, that those are the types of agreements they're signing.
Yep.
And that's why, generally speaking, right, there aren't, first of all, amazing products being developed, I would say, but by the standard of, a lot of healthcare developers get offended when I say that. Like, as there aren't great products in healthcare, but by the standard of, I want to say, like, your general consumer apps, right, like ChatGPT or iMessage and so on, right? To that standard, there aren't a ton of great tools being built, not because there aren't great PMs or great engineers or great builders in healthcare. It's literally just not possible. And there's just a high friction to it, basically. Yeah.
And it's because of this inability to access the data is ultimately what's causing it.
Exactly. Yep.
And
yeah, I'll actually maybe just to make it more practical, right? I'll give you, put it another way, right? If you're a developer, right, and you're building an app, think of the number of specialties there are in healthcare, right? There's, dermatologists. So, like for me, primary care office, I have glasses, so an optometrist, right? I go to a dental office and so on, right? And there are cardiologists, neurologists. Each and every one of these, specialties, there are specialized electronic health record systems built only for them. So as an example, right? Generally speaking, if you're a dental office, you're using Dentrix or EagleSoft. But if you're a dermatologist, you are not using Dentrix or EagleSoft. You're using the system called ModMed. which is cloud-based, and Dentist and Eaglesoft is actually on-prem. And if you're an optometrist, you're not using any of these. You're using some, optometrist-specific system. So just the sheer fact of, like specialization means that, there are unique vendors for each and every one of them. And then on top of that, each and every one of these vendors, even though there's like federal regulation that kind of mandates it, they're also not open systems. So ultimately, it means, if you're a developer, right, you have to, in order to build a healthcare data integrated product for even practices, right, that's the level of integration effort you have to go through. And it's just really, really high friction, basically. Yeah. So, if there are like about 1,000 different systems, if you want to get mass adoption, you probably have to write 100 or so integrations, right? For you to have a large enough TAM. And then on top of that, even if you do at least, before NexHealth, it would be anywhere from 30, 50% of your revenue goes somewhere, to these companies. So you just don't even have a viable business. Yeah.
What about, I hear people complain about Epic.
Mm-hmm.
They're like the biggest one in the space, right?
Mm-hmm.
They only have a couple percentage market share, or?
Yeah. So I think, this is actually a really, really common thing that I want to say I get asked about, which is like, hey, what about Epic? And Epic is the famous name, right? I think they do about $8 billion or so in revenue.
They only do $8 billion in revenue? Like everyone in the world hates them, and they only do $8 billion in revenue.
It could be more now. Honestly, my figure may be outdated. You can look it up. But like a couple of years ago,
that's crazy.
It was $8 billion at least.
I would assume that because I've heard people say like Epic is the reason healthcare is so bad in like one sentence. I'm like, and they only do $8 billion. Like I assume they're like $1 trillion company if they're like truly destroying the fabric of American society. Like, come on.
Yeah. That's what I mean. So they have a lot of brand awareness. I think there's a perception that they own a majority of the market. So what is true though? They do own a majority of the hospital systems.
Okay.
Right.
So how is that different than more like the independents?
Yeah. So if you're an average consumer in the US, right, you're more likely to go visit a local doctor, like for your primary care needs, your ambulatory care needs, right?
Not
versus
a full-on hospital.
Exactly, right?
Got it.
And like a full-on hospital would be, think of, in New York, Presbyterian as an example, which is, a group of like 12 or so, or 8 to 12 or so actual hospitals throughout the city, right? So that's a hospital system, and I'm pretty sure they use Epic as an example. And so Epic owns that market, actually. I think majority of it, at least. But when it comes to, where most consumers in the US actually get their data care, extremely fragmented. Yeah, Epic is not even a player there, and so on. But anyways, Epic is really an interesting topic, and I think, why they're so popular, at least, or considered the evil, bad guys in the industry. So, just like a very quick summary here is this, which is Jodie Faulkner, who I, by the way, admire a lot, in addition to thinking, she's probably like an evil genius from my point of view. Essentially, in the Obama administration, when the Affordable Care Act was passed, along with it, there was a few healthcare tech-related legislation.
Yep.
And there, the government was incentivizing practices to digitize their health records. And the incentive was basically, we will give you $40,000 a year if you digitize, do you remember like way back in the day when you'd go to a doctor's office, it'd be like files of paper?
Yeah.
Yeah. So like at that time,
they still have that.
Right.
Actually, that's not true. I feel like I haven't run into that in a while, but
yeah,
too recently that was still the case.
No. Actually, we still have customers that sometimes, like it's very rare though, that are like that. But anyways, so at that time, that was the problem to solve, right? So the government, sort of incentive was, hey, we'll give you $40,000, a year. If you digitize your records, but you have to, digitize, and you have to meet these like certain requirements in order to qualify for that incentive. And that requirement just happens to be Epic's spec. In other words, Epic gained mass adoption, especially at the hospital level, by getting the federal government to pay their customers to adopt their software.
Wow.
Yeah.
That's insane. So what a go-to-market. The government does it for you.
Yeah, that's what I mean. I admire her, evil genius. Not that that's my...
Yeah. Jeez.
But, she pulled it off. And honestly, like, I would say, like, she really is the Bill Gates of our industry. But at the same time, the way the hold that Epic has on the space in the hospital ecosystem is not healthy, I would say. And again, I think it's only a matter of time until this all changes. But yeah, that's part of the reason why Epic is so famous.
I think it might be interesting for people then. Some people might know of you, might know of NexHealth. For someone who's like literally never heard it before, first time I'm encountering you and the company, like how do you describe it and what do you guys do? How do you fit into everything we were just talking about?
Yeah, so the very simple explanation is that we're the platform for practices and the developers that build for them. What does it actually mean? What it actually means is that today, as an example, in our space, we have the largest developer ecosystem where these developers use us. Honestly, I don't want to say the exact number yet for competitive reasons.
Got it. Are you guys the biggest?
Yeah, by far. By far. And there's a bunch of other reasons that we can maybe talk about offline. But we just talked about Epic as an example. But we are the largest by far. And so the use cases there basically is this, right? So you take a company like Align Tech, which are the makers of Invisalign.
Nice.
Yeah.
They're pretty big, aren't they?
They're massive, yes. They're actually out of San Jose. So their use case as an example is, if you go to Invisalign.com, you should be able to book with a provider that will give you Invisalign cases, right? Like that accepts Invisalign cases. And they're using our infrastructure to connect their providers that are trained for Invisalign to consumers. That's one use case. The other use case would be something, one of the most popular ones these days. A lot of the YC startups are actually built on top of our API, which is an AI phone agent, meaning, more often the use case is you call your practice or, whatever doctor you're going to, right, after hours. The AI agent will pick it up and you may want to reschedule your appointment. You may want to cancel it. And the AI agent, will need to ask you, hey, what's your name, date of birth? And once you give it, it'll need to know, what time is your appointment and then actually action that cancellation or that reschedule as an agent, right? Otherwise, it's kind of useless. And all of it is built on our API and our infrastructure. So that's one use case. The other use case is that, we do have a product that's built directly for these practices at the same time, where if you're a practice, you can buy NexHealth, and we will digitize every single step of the patient journey. Where, the key value prop there is that if you think of, our competitors that came before us, where the software was built to basically help you manage a set of tasks, right? If you're in an office, operationally manage a set of tasks.
Yep. So if you're like the reception woman or like the billing person that sits in the front and is like always on the computer clicking buttons with a stack of papers, inputting data.
Yep. Where the core differentiator for NexHealth comes, though, and it's only possible because of the infrastructure we focused on building first, is that we actually we don't help you manage the task. We do the tasks for you, like literally, right? And this has been the case for us even before AI. So this is, this isn't because of AI, but like really, because of the infrastructure that we own, right? What it means is that, you're a practice, you can buy NexHealth, and all you really have to do is, configure it, set up some rules and so on. You turn it on, and every single step in the patient journey gets automated. And honestly, like you don't even have to log into the product, like our product, except, maybe if you want to respond to patient messages, like, you're a patient and you responded to a text message from NexHealth or something, and then a staff member has to respond back. And that is what we optimize for. Like, unlike, most companies where the objective is, session time as an example, right? You want your end users to spend as much time in the software as possible, right?
Yep.
We optimize for the opposite. Like we think, if our end users are spending a ton of time in our software, we're failing somewhere, because the core value prop, right, is that we do the work for you. So you don't have to log in even, basically.
So you just talked about before you explained this, you said you can't really access any of this data typically. How are you then doing this where you can?
Yeah.
And maybe it's worth talking about like some of the first instances of doing that. Like how did you initially start to build the platform, like going back to the very beginning? Maybe even before you actually started.
Yeah. Happy to actually maybe like explain the full vision here, right? So our mission statement is accelerating innovation in healthcare. And, like I shared earlier, this isn't the first time that anyone's tried to tackle this problem. It's been a problem since the 90s, right? Like,
so people have tried?
Yeah, many startups, even the federal government, right? Like, as in the whole reason the federal government cares about data interoperability is and digitization of records, right, is because the federal government genuinely wants more innovation in healthcare. And the federal government wants innovation in healthcare because, healthcare is about 25% of our GDP at this point.
I mean, it's like a huge chunk of the budget. If you just go like, where's the money going to? Medicare, Medicaid, Social Security, a lot of that is related to healthcare in some aspect.
Yeah. So, when I was 22 or so and my co-founder, we were ambitious enough to tackle this problem and we thought we could. And the reason, we thought we could is this, which is, generally speaking, whenever any company has tried to tackle this problem, they take either of one approach, which is they're going to be built specifically for hospitals. And if you build specifically for hospitals, which is, what seems like the large enterprise kind of attractive market, right? If you're a startup.
Those are pretty big deals, right?
Yeah, like VCs will fund you and so on, right? Only to realize after a certain point that actually Epic will just kill you, basically.
Really?
Yeah, because
Epic just doesn't allow you to compete. Doesn't allow you to get a foothold.
Yep. Yeah, and by the way, Microsoft tried to solve the same problem that we're solving right now. And they also ran into friction with Epic and Cerner and so on, which is Cerner is basically the second largest hospital-based electronic health record system.
Google, how are they able to do it if the government wants to solve this? Couldn't they be like, guys, cut it out? You can't do this anymore.
When you can build anything, Amplitude lets you know how to build the right thing. Use human language to get complex answers about your products. No more manually selecting events or building charts or dashboards. Just ask. Use agents to sense changes in customer behavior, decide what's causing them, and ask you if it's okay to fix it continuously in the background while you work. Get the answers you need while building directly in the tools you are already in, like Claude, Cursor, Lovable, and more. And for the first time, understand if your agents actually work. Measure quality, debug failures, experiment, and measure their ROI with agent analytics. Amplitude. With AI analytics, all you have to do is ask. This episode is brought to you by Merge, the connective infrastructure for production AI. The hardest part about building an agent is everything around it. Connecting to the tools your team and customers rely on, letting agents take action with the right permissions, and keeping everything reliable and cost efficient once you're in production. Merge handles that all for you. It connects agents to thousands of tools, handles permissions and LLM routing, and lets teams move faster without building it all themselves. OpenAI, Dropbox, and Ramp all use Merge to move faster and build AI right. Visit merge.dev/Turner to start building for free. That's merge.dev/Turner to try Merge for free.
The government tries, but then, so I think twofold here, actually. A lot of the regulation actually doesn't have precedence, meaning there hasn't. So you can pass regulation, but one, you have to enforce it first. And that, swings back and forth depending on the administration that's in power. The second thing is, in order for the government to enforce it and or, a court case, let's say, to go through, it's easier for the government to enforce it if there's precedence of court cases as well. How do you interpret the law, right? So a lot of the regulation is so new that actually hasn't happened enough times that it's very clear cut. So Epic, basically what they do is they say, hey, we think regulation says X, Y, Z versus, there was a famous, battle between Microsoft, Google, and then Epic. I think this is 5 years ago or so, where the argument was, Epic was hey, we think regulation means X. Google and Microsoft, their argument is we think regulation means Y, right? And it's sort of who wins because there's no precedence of court cases.
Nothing's been settled.
Exactly. So if you're Epic, right, and you're doing 8 to 10 billion in revenue every year, you're cash flow positive and so on, you can just take a startup and have them mired in court cases forever, and you're dead, right?
So that's one approach.
So hospital systems, right? And that hasn't generally worked. The other approach is SMBs, just we're targeting, right?
Yep.
And the SMB space is also attractive because unlike the hospital market, the SMB market, when it comes to EHR systems, is extremely fragmented.
Why is that attractive for a startup?
Yeah. So as an example, right? If you're looking to build, what I call let's say a plaid, right, for healthcare, the value prop is stronger if you can say, hey, integrate, with us, and we will give you access to 50 or 100 other integrations versus, like Epic or Cerner, which is just two systems, right?
Yep.
So a lot of companies do try to go after the SMB market from that perspective. Then they immediately run into the blocker of either, that practice is using an on-prem system and maybe there's no API, Or, there, a lot of the market does use cloud system these days, especially, right? I want to say like 50 to 40%, especially on the medical side. Even if it's cloud-based, right? Either, the API is like extremely limited. You can't just go and self-serve sign up like, most other SaaS vendors. You have to actually form a real partnership. Like you have to have conversation, negotiate, get the rates, what endpoints you can access and so on, right? So for startups, that like 12 to 24 month cycle, it's just too long. That's one thing. And the second thing is if you just put that, the partnership, the restrictions, the incumbents, they want to block data. If you just put all of that aside, like even if all of that was solved, just as an FYI, you still have to write, 20, 50, 100 integrations for you to have scale as a product and as a company, right? Anyways, all this to say, so those are the set of challenges. But if you can solve it, right, as a company, you're massively valuable to the ecosystem. Part of the reason, I want to distinguish two here. Like SMB is more attractive because it's a harder problem to solve. And if you can solve it, you are just more valuable to your customers, basically. What ends up happening on the SMB side, though, is most companies before us have tried to take the approach of, hey, we will partner and aggregate all of these relationships and end up, building a product where maybe, it's not as good as like you can read and write anything, with Plaid, you can read bank data and you can write back bank data and lots of different types of financial data, right? Maybe, the product isn't as great, but at least, we can aggregate all of these different systems through partnerships and make it available to developers. So there are companies that have tried that approach as well. The problem with that approach also is that when you sign these, agreements and these partnerships with these like various EHR systems, you end up having to share 30 to 50% of your revenue with those EHR systems. And if you think about, like where an API or like an infrastructure company sits within the, software supply chain, right? Your margins are, your take rate, within that supply chain, right? It can't be so high that if there's a developer that's building on top of you, they have to price so high that, they just price themselves out of the market, right? In other words, they have to price so high because they have to share that revenue with these EHR systems. And that in itself just like literally prices them out of the market.
Interesting. Yeah. So it's just like too expensive for any developers to use.
Exactly.
Interesting. So when you started NexHealth, I think you were working, the first inklings of this, it was like a summer job at a clinic. What were you doing?
Yeah. So at that time, I was exploring maybe going to medical school or do I become a software engineer, basically.
Because you learned to code growing up?
Yeah. In high school, watching YouTube videos, basically. Man, with Gen AI, by the way.
So much easier
man,
than
the kids
YouTube.
These days.
It's like, man, back in my day, we used to have to watch a 2-hour YouTube video.
Yeah. It's crazy, actually, if you think about it now, man. Yeah. Anyways, I was exploring like medical school or something else. And as a part of that, one of the things you have to do if you're looking to get into medical school is that you have to show you have some exposure, like real exposure to the field of medicine, like what it's like to be a doctor. So, most students, what they do is they'll volunteer at a hospital or something of that nature. When I was in school, I also needed a job. So I just, was crafty enough to like get a part-time job with a professor, at my school who also practices part-time basically. Okay. And, he was basically about to retire. So he gave me a lot of freedom whenever it is. And I was basically the receptionist over the weekend. And anyways, all this to say, so I was the receptionist, which means, one of the great things about that job is that you get exposure because you're the router of information. Really, like that's your job, right?
Like every single patient that comes in, you
exactly.
Interface.
And then you coordinate, with the labs, with the pharmacies, with maybe other specialists, and so on. So you get exposure to everything, right? And at that time, what I was really trying to do here is, hey, why can't I just like automate some of these like repetitive communication that I have to do, right? Hey, dear patient, you have an appointment coming up, at XYZ time, right? Yep. So this is like 2014, 15, I want to say. And at that time, so I was like, okay, I can probably just, build this myself. I reached out to eClinicalWorks, which is, one of the vendors, the electronic health record system that my, doctor was using. And their response to me was basically, hey, we don't have an API, but we can give you one for $40,000. And I was like, well, look, first of all, I'm like 21, I think, at that time. Anyways, so like, at that time, like my kind of insight was like, wow, as a college student, right? If I can't do this and like, just hack together something, what about, like everyone else, right, in the space? And then one thing led to another, I want to say, and realized over time, like actually this is like a massive problem in our space. And within my kind of motivation for like, all right, what do I want to do with my life, right? Like that was a question for me as well.
Yeah.
Ultimately, it was, about impact for me. Part of the reason I was exploring medical school is that I've always been, like whatever I do with my time just has to be impactful from my point of view, at least, right?
Yep.
And being a doctor is great. However, I think, having impact at scale is better, right? And the best way to have impact at scale is, I think at least today, right, more pragmatically, and something, maybe you can control more than other kind of areas here, which is if you can, build something useful for the world, you put go-to-market behind it and you make sure it's in the hands of everyone. And you can, really change the world, right? Like the iPhone, as an example, is a great one, or, ChatGPT is another great one, right? So anyways, all this to say, that exposure to that office, plus having the interest and the ambition on impact at scale, led to us, me and my co-founder Waleed, basically getting together and trying to build this API for ourselves at first, and then hopefully the whole world.
You like first started, the first thing you built was just like some Twilio, like strings and chains, essentially.
Exactly. And actually, like the funny thing is, we actually tried. I was bashing partnerships. Do you have to, go through all this right there? So that is the approach that we took ourselves. Just with eClinicalWorks and a few others. And here's like a crazy experience, just as an FYI. So we're still we don't really have product market fit, but we have something. There's a large customer that was interested, and they'll give it a try. First one ever. And this is, I think, like 2018 or so. And I'm at the office of that customer, and they're like, well, we have to call eClinicalWorks to give you access to their data. So they call him, and I'm live on the phone, right? And some partnership person from there finally picks up the phone, and they're like, no, don't work with NexHealth. We have this solution ourselves. Live on the call, by the way.
They didn't know you were there?
No, they knew I was there. Like they knew I was there.
Okay.
And like, I had email chains going with them on threads, right? Where like, and we have something signed with them, I believe, at that time as well. And it was all this to say, like, and they knew we were a startup too. They were like, yeah, just don't use this, guys. Let's set up another call. We have a solution for you. So that's how, anyways, like, so that's when we realized actually like the partnership approach is not going to work either.
And so did you guys stay in college? Did you drop out and work on this full time? Like, how did those next like year two? Because it sounds like 2015 through 2018, like that's quite a bit of time.
Yeah, I mean, so 2015, I think I was a sophomore in school, and so at that time, honestly, this was a hobby. I want to say more than anything, right? We're still in school. My co-founder and I think we really got serious about this. I want to say like our last semester at school.
Okay.
And it was all of this to say, what we got really serious, honestly, like when I saw how big the problem was. And I want to say I was naive enough at that time where like that was more exciting, if anything. Like, oh wow, this is such a massive problem.
Yeah.
Healthcare is such a large space. If we can, solve this will have massive impact. Not knowing how hard it would be.
Yeah.
Right. And then we got some validation in the sense that every time I would talk to a practice and myself, seeing the pain, right, that this is a really valuable problem to solve. And the key question was honestly for us at that time, it was, okay, what do we build? Given we couldn't even build the Plaid, like the API product, by partnering with any of these companies. So the real question was, okay, how do we go about this? What do we build? And what should be our first product? Because historically, before us, a ton of companies tried an API approach where they tried to build Plaid for healthcare and it didn't work, and so on. Ultimately, so just to like fast forward, like the strategy that we landed on is this, which is, if you think about it, right, these incumbents, they're not open systems. They're the gatekeepers to innovation, really, right? And they're just not incentivized. Really, ultimately, everything comes down to incentives, right? Yep. They're just not incentivized to be an open platform and give you access. What are they incentivized by, though, on the other hand, right? So like if you're Epic, if you're any of these companies, right, what are you incentivized by? You're incentivized to keep your customers paying you and be happy with you. Some don't even care about that, honestly, but like generally happy with you, right?
Okay.
So like, then just thinking from like first principles, okay, then our job is to make sure that those same, practices that pay these vendors love us, wants to use us, and really gives these incumbents no choice but to either tolerate us or partner with us. So how do you gain that outcome, right?
Yeah, you have to get to that point.
Exactly, right? But the way you gain that outcome though is this, right? So what are these EH, just from first principles, right? These incumbents like Epic and Cerner or like, Dentrix and Eaglesoft in the dental space, what do they have that we don't have? They have the, like really direct relationships with these practices, right? So like, in terms of like, what do we build? Let's build something that's genuinely useful for these practices. It either, makes them money or saves them money. Like it has to be, that has to be the incentive for the practice owners as well, right? And as long as, these practice owners value our product, they become, dependent on it in a sense, like where they can't even, like it has to be so good that they just can't live without it. And as long as, we can really quickly gain enough mutual customers with each and every one of these systems, right? The incumbents, the electronic health record systems, they'll basically have no choice but to partner with us or support us. So, here's an example, right? You look at a company like Henry Schein, which is, one of the larger, they're like the Epic of basically dentistry, let's say. Okay. I can go into what that means.
I've heard of them before.
Yeah. So, so as an example, we have something like 10,000 mutual practices with them. We don't have a partnership with them or anything like that. We bypass them as well, and we go directly to the practices and the database, or if it's cloud-based, directly to the browser in itself, right? So over time, the evolution of our relationship with them has been this, which is initially, they really tried to like block us because, we had like maybe 100 customers with them. And then 2023, they went as far as sending a mass email to their entire customer base and showing an in-product pop-up to like half the dental space, by the way, to not use NexHealth.
Like a pop-up in their product, saying?
Yeah, and an email. And at that time, it was terrifying. I was like, well, I guess some brand awareness, but because at that time, no one even knew who we were, right? Anyways, and then over time, it's evolved to now neutral to like, hey, maybe we should partner. But anyways, yeah. So over time, that problem for us, where they were very hostile, they were like really just trying to kill us, has been solved. And the reason it's been solved is because there are 10,000 practices out there that use NexHealth for their scheduling needs, for their payment needs, for their paperwork needs, for their patient communication needs. And for Henry Schein, the question is, okay, do we want to turn off 10,000 practices that really rely on NexHealth, right, for their day-to-day operations? Are those practices going to be happy? Of course not, right? So the reason, we started with our SaaS product first, really, is to gain that incentive alignment one way or another, right? Like, of course, Henry Schein is not happy about it, but their incentive really is aligned with ours to a degree now, where both of us just want to support our customers, right? So it probably makes sense for us to at least talk to each other and maybe partner with each other, right? So taking the approach of building a SaaS product, making sure it grows as quickly as possible, and then releasing the API product means that our SaaS offering lets us actually protect the API product in a sense and make sure that no other vendor that or like developer that builds on top of our API actually gets disrupted by these incumbents.
So by building the SaaS, you build relationship and trust, and then you build the API on top of that, and that enables what specifically?
What it basically enables is that if you're an EHR system, right?
Yep.
Typically, for context, as an example, maybe I'll use a Plaid example. Do you remember a couple of years ago there used to be headlines like, oh, Capital One is blocking Plaid, right? Or like
exactly, yeah.
Or like Chase's. Yeah. So like we have like a very, very similar kind of dynamic in our industry where like these incumbents, they'll like release some software update that'll basically try to block our access to the EHR system, right?
Oh, it'll be like disguised. It's like, oh, just an update.
Exactly. And that used to happen just like every 3 months or so. They don't do that anymore because there are just so many of their customers relying on our software now.
And so that makes the API better because developers can rely on it.
Exactly. And just connecting it back to why developers, or startups before us didn't succeed with the same product is that they just didn't figure out a way to align the electronic health record vendors and their incentives to to support an open ecosystem. Like we kind of forced forcing their arms, right? In a sense, right?
Happen,
Yeah. But like, so like if you're, let's say, a Plaid for healthcare, all you are is an API company. And like if you're Epic, right, you can just be really hostile and like push some update that just like blocks your access completely. And that means, every app that's built on top of your API, right, is also disrupted, right? So, and you just kind of go out of business. Versus, with NexHealth, right, they can try to do that, but we have direct relationships with these practices, and of course, we recover really quickly. Where honestly, like we've never really had any downtime there either. But more generally, the bigger we get, though, it rarely happens now because you just don't want to disrupt the whole market if you're Epic, basically. Yeah.
So it's basically like you have to get the trust of the end customer. I think the number that I saw, maybe it's bigger today, there's something like 89 million people that like touch the NexHealth product.
Yep.
So something like 25% of the population is like
89 million consumers. Yep.
Wow, that's insane.
Yeah.
Talk about have a big impact on the world. Hopefully the NexHealth product is good, but so many people are using it, it's probably pretty good. Yeah. And so back when you first were doing the very first customer, very first integration, like how did you get around this whole like we can't access this? There's like a server in the closet. Like how did you make that work?
This episode is brought to you by Monaco. Monaco is the first revenue engine built specifically for startups. Monaco's AI native platform replaces your legacy CRM and sales point solutions. It has everything startups need, all in one place. Monaco helps build your TAM, generate demand, run outbound, capture every interaction, manage pipeline, and automate follow-ups, all in one tool. They pride themselves on an effortless onboarding, white glove activation, and get you to value in days, not months. And the product practically runs itself with built-in agents that are always working for you. Start growing your revenue faster with Monaco. Try it now at monaco.com.
I want to say, like one of the things that we did, and this will sound, I want to say like just a general framework for how to find product market fit. Putting the integration question aside, but it did, that approach I think also helped us solve it, right? In terms of how to find product market fit, right? So my co-founder and I, we were in New York at that time. That's where we grew up, and we decided that hey, all we're going to do in terms of finding product market fit is that we're going to only focus on the neighborhood or like this specific zip code specifically, which was Soho at that time in New York, and make sure I actually went into the offices to pitch them our product.
And this was all dental.
Exactly. And the reason we chose dental specifically, just as an FYI, is that medical is way more fragmented than dental in terms of like a vertical specialty that's large enough that we can just focus on it and have a meaningful business to start as a wedge.
So the EHRs were concentrated enough that you didn't have to do that many integrations, and you could still make enough revenue fast enough at enough scale to justify
exactly.
it.
Yeah, like as an example, in dentistry, if you integrate with like 5 systems, your TAM is probably around 100,000 practices. Versus in medical, if you integrate with 5 systems, your TAM is probably like 20,000 practices. It's like that like wide, by the way. Anyways, so we chose dentistry, and we thought it'd be a good wedge for us. It's highly, highly competitive. On the other hand,
competitive in what way?
As in, there's just a ton of vendors in this space for like similar reasons, like us focus on dentistry. Anyways, so we would actually go into the offices, try to sell them, and then we'd be like, okay, use dentists, show us your server. So we, at that time, by the way, figured out, okay, thinking from first principles, it's a SQL server in your office. Why can't we just like run an agent that just runs a cron job every 15 minutes, some cycle
this
basically.
This is a pre-AI agent, right? Like this is like a recurring
This is the old definition of an agent. Yeah, like an on-prem agent. So anyway, so we're like, why can't we just do that basically, right? As long as the practices consent to it, and a lot of practices would consent to it.
Really?
Generally speaking, because they know it's their data. They own the hardware, they pay for it, and so on, right?
Yep.
And as long as they trusted us, they would give us access to their server, and we would basically reverse engineer the whole schema in terms of like how do we write this like various patient data, run this cron job on that machine locally, and anyways. So that's honestly the approach we tried. Like we're just gonna go into the office, get access to the server, and without an API, or like, official access for on-prem. The traditional API method doesn't, really exist. But more generally, like, without going through the actual vendor that makes the software, actually just go to the local machine, because there's a local machine that stores that data and read and write into that local machine at the doctor's office. And the only reason, we even got to that insight, honestly, is because we would just go in person and talk to a ton of practices, and either to convince them to use our software or like learn more. Mm-hmm. And one thing led to another, and a couple of them let us do it. And that's, how we kind of scaled to this point, to this day. Yeah.
That sounds like extremely, it's almost like not scalable.
Mm-hmm.
Like they go to offices. Like,
mm-hmm.
So what would you recommend, like, in terms of like knowing that this isn't like a dead end? Like,
Mm-hmm.
were there any, like, in the process of this, you're like, oh, I think this is like not going super, super well yet, but we should probably keep doing this? Like, were there certain indications you're getting
Mm-hmm.
as you're going that like this strategy could work?
Yeah. So to be clear though, in the like, if you don't have a product to begin with, right, whether you're doing scalable things or not, doesn't matter. Like, who gives a shit?
So it's
right?
still just like making the product.
Yeah. Like, we're still just like, remember, at that time, we didn't even know, right? Because the partnership approach that we took with these vendors first just didn't work. They don't want to partner with us, basically, right?
Okay.
So it's like, okay, our product doesn't have any value unless we can read and write into, those on-prem local machines. So we don't really even have a product, right? And the approach we took is like, we're just going to canvass the neighborhood, go into these offices, and see if we can run some local agent on that machine that'll let us, run our cloud-based software. So you can go to nexhealth.com still, log in, but the data exchange, though, on the other hand, right, is locally some cron job running locally at that office that's connected to our AWS, or like an our backend. Basically, that's the way to think about it. Anyways, in terms of like scalability, though, so the reason I say we would go into the offices and actually physically, manually configure out a bunch of this, right? That's what was needed to gain trust from the offices. Like, we'd show up in person, right? First, and second is that's what was also needed to like go through the discovery process of actually how do we reliably read and write into these systems, right? But in terms of scalability, honestly, we always knew we could productize it. Like, as an example, right? You download Spotify, right? Like, you can download it on your MacBook, as an example, right?
Yep.
Or Notion, or like any software on your MacBook, right? Very, very similarly, you can go to nexhealth.com/download, and you can download NexHealth. If you use a local machine or like, an on-prem server-based electronic health record system, you can just download it and, consent to a few things. And within, I want to say, like 10, 15 minutes, you're up and running today.
And so you were basically mirroring their on-prem server into the cloud. Anytime there's a change to the server, it would like eventually get updated to the cloud and maybe got faster.
Yeah, like I would say, like, that's one way of saying it. Yeah.
Okay.
Yeah.
I guess I say it that way just because I feel like I've seen that approach with some of these like system of record companies that are like kind of AI native. They'll like, you run your like traditional cloud system of record, and then you have like your AI one, and the AI one, maybe you don't have to adopt it right away, and they'll just kind of mirror the cloud-based one, and then like maybe you use the AI one to like do some work and like get some stuff done, but you still have the other one, and like it's easier to kind of transition the customers over and get them to try it without like getting the full adoption. Mirroring, you like mirror the system of record, I guess.
Yeah, like actually, I wouldn't say. Yeah, I thought you were saying not literally, but more of as an analogy. But actually, no.
Oh, so you did not do that?
No, we don't do that. No.
So then, how did you do it back originally?
Yeah. So like, here's what I mean, right? Like, if you're, as an example, right, if every company, like every cloud-based software company, right, they have a Postgres database, right? So what our customers and these practices have in their offices is an equivalent of a Postgres database running locally, right?
Okay.
And that's where all the patient data exists. And our job is to like sync the data back and forth. That's
this is literally like a file that's just saved on the computer.
Exactly right. Okay. So, and then our job is to like figure out, okay, what is the schema of that database that's in the office? Because you're a patient, right? You have appointments, you have contact information, you have prescriptions, you have your past appointments, your family, and so on. Like, there's a whole schema that's set up for you in that local database, right? And if we're going to read that data, but then more importantly, write that data, we of course have to insert the correct data in the right tables in that Postgres database, which they don't use Postgres, but I'm just using it as an analogy here. I wish they used Postgres, but anyways, just using it as an analogy here, more generally, right? So we have to like basically read and write and sync data between, some local server at some office and NexHealth, which is a cloud-based software, right?
Yep.
Without an API from the vendor that makes that local software. And the way we do that is we basically run a piece of software on that machine in itself that connects to our cloud-based system and just syncs the data back and forth, to put it very simply. Again, like we were young and we had a lot of time on our hands. Like we were really passionate about the problem. Honestly, it was like really interesting to us.
Yeah.
These days, honestly, I want to say like, well, with Gen AI, I guess like software engineering, you don't have to learn it anymore. But I want to say like a couple of years ago, software engineers more generally like don't even have to deal with this on-prem systems, networking, and so on, right? So to us, it was interesting from that perspective as well.
Yeah.
We're SOC 2 compliant. We do our annual HIPAA audits as well, and so on, right? So all of it is compliant and secure. And in fact, honestly, like a ton of these EHR vendors will have a ton of security incidents. And like to this day, I don't think we've had any that I can think of at least.
Really?
Yeah. So like we've been able to productize it to that level and encrypt it to that level and bring that level of authentication to security. And
Wow.
more importantly, honestly, like make it that reliable that like we have never corrupted a database to this day.
Wow.
Yep.
So all this stuff you were doing, had you raised a little bit of money, right? Like just to get started, or had you
like do you mean like early on?
Through this whole process of like 7 p.m. staying up till till 1 a.m. Like, did you raise any money to do this? Were you guys like working other jobs? Funding this? Like, how did this all go from just like a capital stack side?
Yeah, honestly, at that time, okay, so my co-founder, he was selling used computers or something on eBay, and I still had like my part-time job basically while we're doing all of this. So yeah, at that time we didn't have any funding.
Were you at that time any money from customers or
no? Like remember, we didn't even have a product to begin with. Like so the whole so just to maybe know like what the product is, right?
Yep.
So the original insight was okay, we have to build something, build a relationship directly with the end users, meaning the practices that own the hardware and the database and has and pays these EHR vendors and so on, right? How do you do that? Okay, you have to like build a product that's revenue generating. So we basically built this like scheduling tool. And at that time, like an online scheduling tool wasn't new either. ZocDoc, a bunch of competitors were already dominating the market. However, where we differentiated is that we can actually read your real schedule in the office and the schedule runs off of that on-prem system. We can read your real patient data, and then we can actually write back as well. Like the write back part was like the most, I want to say, like the differentiating part at that time. So what it basically meant is this, right? Like let's say, you're a dermatology office or a dental office, or you're like a PE roll-up, right? Like a 10, 20, 15 offices even. That means, and like oftentimes, you'll run some paid advertising to attract patients. You have, Google Maps, you have Yelp, and you have social media, and you have your website, and so on. And the business model of every practice ultimately comes down to how full is each room, and is each available slot for each provider filled up or not?
Because it's basically like a capacity utilization.
Exactly.
Where you pay rent, you pay the doctor, the nurse, et cetera, and just like, that's fixed. You don't just say like, hey, we're just not going to pay. Like you need to have the rooms full of patients.
Exactly. And then you also have to think about, like, so in the tech world, we don't really think about these things because it's software. It's like you can scale, hypothetically infinitely, right? For a practice, there's a ceiling to their growth, right? And then after that, it just comes down to, utilization optimization, but then efficiency in terms of how do you optimize it, right? So anyways, all this to say, especially in the larger cities, this happens often, which is, they do spend some money on marketing and social media and so on, right? So we basically built this scheduling product where the value prop was, we can read real data, like as in like if there's a slot open, we will know it within 30 seconds. And if there's a patient that wants to book an appointment, we will, collect all of the information from the patients. We will then, write it back to the calendar exactly the way one of your staff members would. And that logistics, just as an FYI, in terms of a product build, is like way more complicated than you'd think. Because, like as an example.
Well, this was pre-generative AI too, right? So like how you the schema of like how data is transferred. You had to like get it, You're like one shot perfected every time.
No, honestly, like even the product design though, like I'll give you an example of what I mean. Like let's say you go to a dental office, right? What do? You first see a hygienist, right?
Yep.
And then you see the dentist, right? So that means, like as a software, you have to coordinate those times. And like what is their
So
availability?
there's really like 2 appointments.
Yes. And then oftentimes it's in 2 different rooms, right? So then you have to also take into consideration the fact that this provider may already be, with another patient in some other room. And by the time the hygienist doesn't finish with you or like finishes with you, that provider may not be available. So like, anyways, it's harder than this is the right back part. It's not only the data access, by the way, it's also the logic and like, it's harder than you think basically. Anyways, all this to say, so that part we figured out. Okay. And that's the part, that we want to market with. And the value prop was, hey, if your practice, slot utilization is the, like really what you're optimizing for. One, you can convert new patients across the internet.
Yep.
Just, put NexHealth there. As well as, we can reach out to your existing patients. So as an example, if you're a patient and you want to come in sooner for some reason and you're on a wait list, right? And let's say another patient cancels today at 2 p.m. NexHealth will then just like automatically text you, first come, first serve basis. Like, hey,
fill up the wait list.
Exactly, right? And that was incredibly popular to the practices. Versus in a ZocDoc, as an example, which is the more dominating scheduling tool in our space. Not sure if you're familiar with them.
Vaguely. Like I know of it. It's like a yellow logo, right? Yellow and black.
Exactly. Yeah. They're more like I want to say, like a Yelp kind of marketplace, right?
I was going to say it's kind of like a SEO marketplace lead gen type thing.
Exactly. Okay. So the way to think about that product, basically, the fact that, we like another way to think about it is that we augment your staff now at this point, right? Yep. Like the patient doesn't have to call, they don't have to do anything manually and so on. And once we gain adoption, it's really hard to rip out as well. So it's like, if you rip it out, then that means some staff member now has to spend something like 30 to 45 minutes coordinating those calls from the patient, rescheduling those appointments or filling those slots and so on, right? So basically, what ended up happening is as practices, started using NexHealth, our SaaS product, and they love it, we started growing fast enough that by the time, any of these EHR systems even noticed NexHealth to begin with, there were enough, practices that loved us enough, that advocated for us enough and so on, that, like these EHR systems just couldn't shut us off.
Interesting.
Yeah.
Okay. And people were paying for it at that point, right?
Exactly.
Customers were? Okay.
Yep.
And I think I saw a number, you raised $391,000. Is that the number? It was like, that was like the very first amount of capital you raised?
Yeah. Around that, yeah.
Okay. That's like an odd number. Like,
how did
that come out? Like, was
honestly,
it just like,
like
scraped together? Like someone gave us, like one person gave us like $6,000 and like that's how.
Yeah, so it was man, bringing back memories here. I think I buried that round in my like memory.
Yeah,
it was that hard.
I mean, that's always the hardest round to raise.
Yeah, exactly.
Like. Well, I don't. People will say like the IPO is the hardest. Some people will say like whatever.
Man, that's a champagne problem. The IPO is the hardest one.
Yeah.
Right. Yeah, like so you have to think about it this way. Like we didn't actually have any connections to Silicon Valley or the Bay Area at all. Yep. Any VCs. My co-founder and I, we grew up with immigrant parents, right, as well. So really, like honestly, like we don't really have any connections to money to begin with. So the way that we, raised that initial capital it was 2 sources. One, it was actually a couple of our professors at school, yeah, and then a couple of our customers on top, and that's how we scraped together 390. We still have 2 of those customers on our cap table, still using us, love us. Yeah, so that's honestly, it was our customers and then basically people we knew in a sense, like professors, a couple of friends and so on. That's how we scraped together 390.
Wow.
And then a year later, though, we ran out of cash. So it was terrible from that.
Really?
Yep.
How did you run out of cash?
Yeah, so when we raised that capital, right, we raised it off of, basically think about it this way, early customers, maybe like the first like 10 to 20s, a few of them loving our product to begin with and seeing potential in us. Yep. And the second part was, of course, people we knew, like professors and so on, also seeing potential in us. Yep. But we don't really have anything that could, any amount of revenue, I want to say, that can actually sustain a business to begin with. So, if you take like 20 customers, that's probably a couple of thousand of MRR a month for us.
So you were still burning money.
Yeah, exactly. And it was me and my co-founder. We hired, 2 or so engineers and so on. And we talked about earlier what it took for us to figure out how to read and write to these on-prem systems, right? And you were surprised yourself, like how do you even scale that? Great question, right?
So you were figuring it out with the 390,000.
Yes.
Okay.
Yes. And it took us a year plus to like get to some level of stability with it.
Okay.
Where even if we would sign customers, they would actually end up churning, basically.
Really?
Yeah.
Man, that sucks.
Yeah.
So why'd they sign up and then churn? Like, what was the issue?
So they would sign up because of, like the potential of what it could do. It's something new to them, right? So it was early adopter still. So they would give us a try for a couple of months. And then eventually it's like, if it doesn't work, it doesn't work, right? Like it's not stable enough. Because the thing about our value prop, by the way, is that if you're going to have your ads running, let's say, right, and you're spending money on it online, and NexHealth is the CTA for it, where as a patient, you're advertising, hey, we do Invisalign, and you click on it, you fill in your information, right? It has to be reliable. Like meaning, if the value prop is that your staff doesn't have to monitor that channel, and it just like writes back to the on-prem system, it has to do that. Otherwise, you're losing money as a practice and patients, right?
Because you're not generating any revenue from those ads.
In fact, you're probably causing them to lose money because, like, as in, like, when I say, the stability of the integration, right? If you're a patient, you click on some Facebook ad, you fill out a form on NexHealth, and you pick, you can see the real-time availabilities from that practice. You pick a time tomorrow at 2 p.m. as an example. You fill in your information. We take that information, and then we have to, sync it back to their on-prem system, right? Oftentimes, syncing it back, meaning like writing it back, just wouldn't work for one reason or another. And that, patient and their information would just not go through. So the patient would oftentimes show up and be like, what are you talking about? We don't have your appointment. Yeah, it was like that sort of problems.
Oh, wow.
Yeah.
So like we need to get rid of this, like this thing's like causing chaos in the office.
Exactly. Anyways, all this to say, like the real problem that honestly was that we were basically not focused on making any one system and the integration we have with it work first. We were like trying to make 5 of them work at the same time. So like after like 9 months of trying, we realized, we just have to focus on one system and make that great. And then just as we like started making that great, customers would stay with us, sign with us. They were happy. They were referring customers. We ran out of money basically. So it came at the nick of time. Yeah.
Jeez.
So like we've always had product market fit because again, like our mission statement is accelerating innovation in healthcare, which means by default, there aren't a ton of competitors to begin with. So like, as long as we can make the data integration work, right? We knew that it sounds so basic, right? Like honestly, whenever I talk to people in tech, they're like, okay, what's the big deal? But it sounds so basic. But for our space though, like it doesn't even exist today, right? It's all manual today. So anyways, we knew that as long as we could make that work, any product we build on top would be valuable to customers. And as soon as that clicked for that one system, we started growing really quickly. But then like a year in, we cash balance was basically $4,000.
Yep. Like you were gonna die in like a week or two.
Yeah. Well, at the end of the month, it was like that sort of a situation.
So how did that month go?
Yeah, that was honestly, I want to say, like thinking back, it was probably. Sometimes people will ask me like, hey, what is the closest NexHealth came to death? Throughout our history, I would say like that was the only one where it truly was a consideration for me and my co-founder of like, hey, we're still young. Maybe, we just got a job, basically.
Yeah. You had a bunch of credit card debt too, right?
Yeah, exactly.
I think I read on the website, you had essentially maxed out your Amex card. Your credit score was 500 something.
Yeah, 530 something.
And you got like a court order from Amex or something. Basically, like you must pay this bill.
Yes. Yep. Okay. Yeah. So
you really had like negative money.
Yeah,
you had 4,000 in the bank, but you had like way more credit.
Yeah, basically what was happening, honestly, like that 4,000 stayed at the bank because we had to like pay AWS and so on, right?
Yep.
So it's just enough to like pay the bills.
Yep.
But then everything else though, I would be like, all right, let me just max out this credit card.
Yep.
At that time, honestly, like the risk that was for me personally, I didn't really think about it. I think from like maybe just a personal belief, everything would be fine ultimately, right? And of course, it worked out for us, right? To this day, by the way, still kind of impacts my credit score.
Does it really? Okay.
Yeah, fucking Amex.
Don't want to give an Amex is good side. You use Flex. Have you tried Flex?
No, I haven't heard of it actually.
They're going to sponsor this episode.
Okay.
People listening will have heard it early on.
Okay.
It's probably similar customer to Amex, where you're just like a high net worth business owner, gives you a credit card for your business, and then also they're launching a credit card on the personal side too. Flex kind of operates in that space. Anyways,
it's awesome.
Well, you should try it.
Yeah, I'll check it out for sure. Yeah,
they'll give you a better credit.
Flex, I hear you'll approve anything for me, huh?
Zaid's listening to this, like, don't sign me up for that. And okay, so, but I think you guys essentially like landed a customer that like,
yeah.
Really,
so basically, the reason I had to like max out my credit card is so at that point, we had 2 engineers, and I hired this like kid out of college as an SDR as well. And anyways, so we couldn't pay them. Well, of course, we couldn't pay ourselves.
Yeah.
And out of those 2 engineers, one of them left completely, and the other 2 now. That engineer, by the way, is still with us, just as an FYI.
Really?
Was okay to like, delay, their payroll for a couple of weeks, ended up being 3 months though. And then everything else was just through my personal credit card. Anyways, all of this to say, throughout that whole period, right, 2 things were happening. One is, my co-founder and I were genuinely having conversations of like, man, this is really hard. Because first of all, you have to think about it from our point of view, right? We first tried the partnership route.
Yep.
Spent like a year on that, right? That didn't work. And then, we tried, of course, just go to the database directly. And at that time, I was like, okay, is that even going to work? Because it took us a year to like churn through customers and figure it out, right?
Yep.
This is hard, right? So like, maybe we should go back to school. And I remember this is frankly, like I would say like one of my biggest kind of like life lessons as well, which is at that time, I don't know why, but I've always been, I want to say, it's kind of cliche, but more of like a first principle thinker organically. So at that time, I was just asking myself, okay, why do companies or, like ventures fail in general, right? Like, what is the definition of that failure? Like, what point does, can you say it failed? It did not fail. Is it, when you run out of money? Is it, when you don't have a product? Or, like, how do you define that, right? And like, at that time, I realized actually it's a bunch of people just admitting that they failed and or just,
like giving up,
basically. And I was like, well, as long as
you just don't have to give up if you don't want to.
Yeah, I was like, okay, we don't have to give up. Okay, it's that simple. Anyways, it wasn't that simple, of course, at that time. But like, so I was like, okay, like if that's the definition, right? And at that same time, this customer is still with us. By the way, they're massive now. But at that time, there were only 12 locations in Detroit. I was working on a deal myself personally directly, and I was negotiating with their CEO. And this was, I think, like January of like 2018 or so, right? Around February, actually. He's like, okay, we love the product. How much is it? I hear, there's no contract. That's kind of what I, pitched him on, like it's month to month. You can cancel anytime and so on. I was like, yeah, it's a new year. We changed our policy. You have to pay upfront now. and I'm not going to name the CEO, but he knows all of this at this point as well.
Yep.
Anyways, and honestly, like, I'm grateful to that customer and that CEO. At the same time, I think, they saw the value enough. They were like, okay, sure. We'll pay you $36,000 up front, basically. And that kept the company afloat long enough that Adam Lin, who's one of our, I want to say, like actual first VC check in the Bay Area, gave us enough capital that, we were able to sustain ourselves, find product market fit, and so on. Yeah.
That CEO is probably like solely responsible for accelerating innovation in the healthcare industry.
100%. Yeah. He recently came to our CAB or like customer advisory board. And I was like, did you know XYZ story? He's like, I did not know that.
And so I think you famously like didn't really tell your investors this plan, how you were basically going to go SaaS, like software, to the API, to building like this full platform around it. Like, why didn't you, or did you try?
Yeah. So I remember, like in the very beginning, that friends and family round we raised, right? During that raise, as I would like share our grander plans, right? Basically, no one would take us seriously, honestly, because for them, I understand from their point of view, right? First of all, you're just 2 kids, no experience, and it's healthcare where nothing succeeds really. Distribution is hard, and you're telling me that
you have like no customers yet.
Yeah, and like really a product that doesn't work either, right? So I don't blame them, right? But also like, honestly, like at that time thinking back, like if you just look at our strategy, it's kind of incredible that it works today. But like theoretically, if you think about it, I can see why you would think that's not going to work. So like, we're going to build a SaaS product. And we're going to build that SaaS product to get the customers on our side so that ultimately, we can release this infrastructure product that, anyone can use to innovate on top of. And then, we're going to take both audiences and turn it into a full-sided platform. That's like, two businesses in one company, first of all. Yeah. Second is it's two different audiences as well. And then third is like a lot of things have to go right in just the right sequence for you to even be successful as a company. And it'll take a long time as well. So like if you're, a traditional VC or an investor, I can see that's like extremely small chance that would work, right? And I probably wasn't explaining it the right way. Anyways, all of this to say, basically what I decided on the next time, we raised properly, which was, 2018, I think. Hey, we're just going to build a great fucking SaaS business first.
Make software for dentists.
Exactly. And like make sure it grows fast enough, customers love us, the retention is high enough, it's efficient, et cetera, that in itself gives us enough credibility to then tell the bigger story. And that ended up working, basically.
Interesting.
Yeah.
And so this was 2018. I think you raised like a couple $1 million.
Yeah.
And how did those next 2 years go before COVID?
The next 2 years for us, I would say, so 2018, we raised a couple million, and that was purely off of, I think, 100 or so customers, really highly differentiated product. Customers are honestly just obsessed with our product, I would say.
It's a big, that's got to feel really good going from everyone churning
exactly
the year before.
Exactly. And that's, what, I want to say, Christoph at Point 9 to Adam Lin saw early on about NexHealth. At a minimum, this is a product that customers love, right? And they knew about the grander vision as well. But I think, at a minimum, the downside is we're a great SaaS business, right? Yep. And then from there on, I think our goal is really twofold, right? One is, remember, as of now, we only support one integration, which is the time is too small, right? So write more integrations to begin with.
Oh, so you really still just had one single integration. Okay. So did you have to find dentists that had that EHR?
Yeah.
And so what? So
what we basically, to this day, we do this, just FYI, which is we basically go to market and we say, hey, we're NexHealth, we have this product. And remember, this only works if your product is actually differentiated, right? Meaning, you go to a practice, you don't actually support their practice management or electronic health record system yet, but you say, hey, we have this phenomenal product. And if you become a development partner, what we call a dev partner for us, we'll give you a certain amount of months for free and some incentives, but ultimately you'll have this great product and you'll get to partner with us in building this integration and so on. And that's how we've done all of our integrations.
Interesting. So you basically say we will give you access to this for free for a while. If you
honestly 3 months, I would say generally. Yeah.
Okay.
Yeah.
And then that's how you built the new integrations.
Yep.
How many are you at today? How many integrations does NexHealth have? Across just everything.
Yeah. If you consider everything, I think 21-ish or so.
21 different EHRs?
Yeah.
Okay.
Yeah. If you go publicly, I would say in terms of what developers can actually use, it's 15 or so. And there's a bunch of other ones that, anyways, so there's different tiers we have that are public, that are not public. But yeah, in total, 21.
And then what's the business? How many different business lines do you have? Different products? You have something called synchronizers, kind of an API.
Yeah. So actually on the 21 side, earlier I mentioned that, we have to have 100 or so to get mass coverage, right? Here's actually the fascinating part that I discovered over time myself personally is that, one, the market is massive to begin with. Just dentistry in itself, right? So Henry Schein, that company that I mentioned earlier, they're a dental, they're mostly a dental-oriented company. That's the vertical that they focus on. They do $10 billion a year. So you can build that size of a business just within dentistry, basically. So, the earlier lesson on focus as well, right? So anyways, we do have a culture of just genuine focus and not overextending ourselves, I think, as a result of that early experience. So anyways, yeah. So today, we have customers across 19 different specialties as we speak, 21 integrations. So, you can think of dermatology systems to, primary care to dental and so on across the board. We just, support a wide set of specialties just outside of dentistry today. And as we speak today, we have 3 lines of businesses. So the first one was, of course, the SaaS product that we built, right? We charge just a monthly fee to practices. And around late 24, as I started to see signals in the market that, hey, the EHR, the electronic health record vendors, right? like we've de-risked that part of our, the existential risk to the company significantly enough that it's time to, open up our API or our technology to like basically third-party developers. Like anybody can now go on our website, click on sign up, and actually start building healthcare integrated products that then reads and writes to like 15 different systems, giving you a TAM of, I think, like, 400,000 to 500,000 practices. So, we're very targeted there as well. And that product, within 18 months, in terms of like pure number of practices that it supports, has gone to the same scale as the SaaS product that I think, took us. So for the SaaS product, it took us 5 years to get there. For the API product, it took us 18 months to get there. And today, just on a pure scale basis, the API product is larger than the SaaS business. And then, late 25, we released a payments product for practices specifically.
To accept payments from customers.
Exactly. So what it basically means is, have you ever gotten like the statements in the mail from your doctor's office?
Yeah, like lose them and hate them. And
yeah.
Actually, what I get most often is I'll get like the collections bill, and I'll just be like, I didn't even see the bill. I didn't even know like I would have paid it. I didn't even know I owed you money. Like, why are you sending me bills in the mail? Like, I'm a millennial. I'm not going to read that. Just like shoot me an email or a text and I'll pay it.
Yeah. I mean, honestly, like the world of healthcare practice is so insane like, that we can talk about this all day. But
yeah.
So today, like here's how it works, like a payment collection at an office. So the dominant sort of, players in our space when it comes to payment terminals and payment processing is your typical ones, like in Square and like a bunch of other ones, right?
Yeah.
And like, here's like an anecdotal example to exemplify how big the problem is. We have this customer, a couple of minutes from here. So this is like a year ago. They were one of the early adopters of the payments product. They used Square. I went in and just to like, talk to the end users, I was like, okay, how do you like it? And they love the product, right? Why do you love it so much? Like, what do you used to do, right? And so this is what they showed me. And by the way, whenever I go to our customers, I also just actually have a real visit. So I got a real cleaning too. And I had to pay like $50, right? So she's like, you know what? I'll pull up our old system and like process the money through that old, Square basically, and show you what we have to do. So I had this, appointment at 1 p.m. She reactivated the Square terminal and she swiped it. She's like, okay, so you paid this $50, right? And at that, so I had this appointment at 1 p.m. and I think now it was like 1:45-ish or so.
Yep.
She's like, okay, so at the end of the day, what I'm gonna have to do is take the receipt and see that it's $50 around 1:45. And make a guess that, hey, Al's appointment was at 1 p.m. So this $50 payment must be from Al. And then manually type it into the electronic health record system.
Oh, because it's not synced.
Exactly. But like not just synced, but it's like they have to guess who paid that bill. So why didn't you get your bill in the mail? Or like, why did you just get a collection?
Yeah.
Right? It's because often they don't even know.
Wow. So you can't just pay. So even when you do pay right at the point of sale, with a Square, it's not connected to the EHR. So they like, are there ever mistakes then where like your bill doesn't even get like paid properly?
Yeah,
like
a ton. So like at any given time, an average like practice, SMB practice, right? They'll carry like 45,000 every month in AR. And then at the end of the year, I think they write off like a few $100,000.
Really?
To bad debt. Yeah. And by the way, like, so here's like the intricacies of the whole system though. So that payment, that cash payment I just made, along with everything else, right? The reason it has to be, typed back, all the data has to be synced, actually written back to that electronic health record system, is that electronic health record system has a component that connects basically, to simplify it, connects back to like Aetna and whatever, payer
all
they
the
use, right?
Information.
Yeah. And that practice has to submit a claim.
Yep.
To get reimbursed on, the rest of the, the visit amount, whatever you owe, like 500, you paid 50. So, now the insurance carrier maybe has to pay, reimburse that practice for 50, right? So all the data has to be perfect for you to even get the reimbursement. Any error, of course, like if you're an insurance carrier, like you are kind of incentivized to actually not approve a lot of these, right? So like,
or you haggle down too, right?
Exactly. So the pain and like the level of, inefficiency for these practices is that high. So what these practices will do today, though, is twofold. Like one is there's a concept in our space called admin day.
What's it called?
Admin day, like administrative day, basically. So like, this is the typical thing, which is like every Friday, they will either not be open at all or they'll, close the office at 12 p.m. So what do they do the rest of the day? They do administrative work, meaning they'll, type data into their electronic health record system, or they will, send out the statements to the patients through the mail and so on. And oftentimes, they'll have some sort of like an external agency that owns a lot of this for them, where they spend apparently a ton on like paper and postage. Anyways, just
that's insane.
Yeah. And this is the power of, I want to say the Synchronizer API, right? That we have, the core infrastructure that we built that sits on top of, all of these electronic health record systems, reading and writing data, right? Which is that honestly, like whatever product you build on top of it, if you're either NexHealth or an external, founding team, right? Whatever product you build on it, you gain instant 10x differentiation by the sheer fact that you can remove hours and hours of manual work, errors, compliance risk, and so on from a practice's workflow, as well as, lost revenue as well, right? With NexHealth, so this customer that we have, a couple of minutes from here, on the other hand, with the NexHealth payment terminal, I'm a patient, I come in at 1 p.m., 1:45, I have to walk out of the office, right? NexHealth knows that. Like, they have to walk out at 1:45, right? And all the practice has to do is click once, like, hey, I want to collect this balance. And we will auto-calculate everything. There's like a whole calculation process for how much you owe your copay as well, just FYI, that they'll have to do manually, right? So we'll auto-calculate all of it. And, in near like instant real time, we'll then show you the balance on the terminal without any other like manual work. And we know it's you and so on. You swipe it, and then we basically type all of the information back to what's called a ledger back in the EHR system. And then we zero it out as well. So like there's a whole like accounting concept that plays into this as well. So the practice is, like they're what used to take, I want to say like, maybe hours and hours, like a half day, right? Now is a couple of clicks, literally just like a couple of seconds.
Interesting.
Yeah.
Okay. So you said the software product took about 5 years to get to the scale that it took the API 18 months to get to. How's payments been going?
It's, I don't want to share exact numbers here, but in the last 12 months, it grew 308%.
Okay. It's grown even faster than the API product?
Yep.
Interesting.
Honestly, it's like I can talk about this product all day, like one of my personal joyous products, in the sense like the value prop that we offer to these practices is so massive that generally, if customers hear about it, they don't first believe it.
Really?
Yeah. They're like, how do you even do that?
So
right?
what is like the average doctor's office look like that hasn't heard about NexHealth yet and thinks, oh, that just sounds fake? Like, what is their like technology stack kind of look like? Yeah.
So I would say like, there's like two types of, after COVID, like we talked about earlier, and especially last couple of years, the ICP profile has really, really changed, right? And I think that's also honestly like what's leading to some of the faster growth we're seeing, right? But still, you have to realize that, like these doctors' offices, they're so busy and they do genuinely get bamboozled by salespeople all the time in our space. Really? So there's just like a bit of cynicism as well. However, we have a great brand in the space, and customers in the market generally trust us, right? At the same time, though, they'll be skeptical in the sense that like, hey, I pay an entire agency. I have half an administrative day just to like do this work. So how are you guys, turning all of that into a couple of seconds, basically? Like that's the skepticism. But once we show it to them, our win rate there, just as on a pure sales math, last I checked, it was like 72%, which is wild. No one has 72% win rate on any product. Like honestly, like when I saw it, I'm like, is this like data entry? Like it's like a Salesforce hygiene problem? Like an error? It's not. Yeah, it's not. Yeah, it's wild. Yeah.
You mentioned COVID again. So what happened inside the company when COVID hit?
Oof.
Because you guys had only raised, you only raised a couple of $1 million, and it had been a couple of years since you did it.
Yeah. So when COVID hit, so actually, I think here's the kind of maybe chain of events, right? So we raised that, a couple of million back in 2019 or so. Yep. And then a year or so later, basically like 18 months, within 18 months, COVID hit. Right before that, though, we had a term sheet signed for our Series A, like right as COVID hit.
This is like,
and it wasn't public. It wasn't closed yet. It wasn't closed yet either. Okay. So this is how like kind of intense that period was.
Yeah.
Oof.
So like, when did you sign the term sheet?
Yeah. So we literally signed the term sheet, I think, end of February 2020. And and if you recall, like it was, I believe, like first week of March where everything was shutting down, right?
Yeah. End of February, people were like making fun of the sign on A16Z's door saying no handshakes.
Exactly.
And then by the end of the first week of March, people were like the world is legitimately ending.
Yep, exactly.
Okay.
Anyways, hopefully, Josh is okay with me sharing this. So it was Josh Buckley, actually, on that term sheet, right? COVID hits and so on. And like 100% of our customers at that point are dental offices, and you can't really go into people's mouth, right?
You're literally just staying there breathing on them.
Yeah.
And they're breathing on you.
Yeah. So they were all closed for the month, and like they were not paying any vendors, nor taking any demos. They weren't signing up with any vendors. Nothing was happening. And on top of that, we couldn't collect from our existing customers, no new growth, nothing was happening, basically. Josh, is very high integrity. Like, we signed a term sheet. So, we still followed through on it. But honestly, like, from my point of view, I was like, we're probably going to die because our market just disappeared overnight, basically.
Yeah. So you also acquired a company that summer, right?
Yeah. So here's actually kind of how we recovered from that period. It's this, which is two things started to happen basically instantaneously. One is this concept of teledentistry basically started to come up at that time by the end of the month. Meaning like so it kind of disappeared after COVID completely.
Yeah.
But even myself, I was kind of like, why would you do that? But like, if you're a patient, right, let's say, and you have an existing treatment going on, you still have to talk to your dentist one way or another, like every couple of weeks. So like for those sorts of cases, either you could come in or you can do it virtually. Like it's like new regulation passed. So what we basically decided to do is this. We started to give away our product for free to anyone that would sign up. And along with it, we attached this like, video conferencing tool to it, right? And honestly, like given it was free versus our competitors, I think most of them were charging more. Because like...
Oh, for the telehealth?
No,
product?
just like in general for their software.
They just increased their prices.
Yeah, because like, there was like, well, like none of our customers are paying. Anyways, I don't know what their excuse was, but it was basically like within a couple of weeks, every practice realized, oh shit, we need to digitize really, really quickly here if we're going to stay in business and continue to maintain our relationship with our existing patients, right? Yep. So we went ahead the extreme other direction. We're going to give it away for free. And then we did that for like 3 to 5 months, I think, with the terms and conditions of like, hey, in like 6 months, we'll charge you again. And honestly, that shot up our growth significantly because of it and gained us a lot of trust and so on. We didn't collect cash from existing customers for like 6 months and so on. So yeah, like that shot up our growth. And then to your point there, yes, by the end of the year, we did acquire a startup. Yeah. Which was...
I think it was like a pretty significant like product expansion for you guys. Mm-hmm.
Yeah. So here's kind of maybe...
because like you don't see very many like Series A companies acquire like make a significant acquisition like as a percentage of the business.
We spent half the Series A on it.
Really?
Yeah, it was. Yeah, I mean, honestly, like in hindsight, it was kind of crazy that we did it. Like we took a lot of like strong gutsy bets at that time.
Yeah,
and nearly all of it worked out, and I think we wouldn't be here otherwise. So at that time, like our product was just like one product, like one, like it was scheduling still and some patient communication. So if you're, a dental office, right, and you're like 5 months into COVID, you can maybe start to see some patients for emergencies and so on, right? Filling out paperwork through hand became a no-no as well because, it's COVID, right? Like, you're a patient, you would come in, like handling paper in general, that was a no-no. So there, customers needed digital paperwork. And there were a couple of, vendors out there that did it. And a couple of our competitors already had it. Like that's where they differentiated even before us, right? So anyways, all of this to say, that was a real gap that we had. So we could have taken the time to build it ourselves or partner with someone. And that was the approach we took. And then the product was good enough. The team was good enough. It was a small team, like 5 or 6 people that, we just made a move and, decided to acquire them and make it native to our product, basically.
Interesting. Yeah. And then you end up raising a Series B and a Series C over the next like year-ish, I think. I mean, the company was going pretty fast, right? So are you like going back? I mean, it's 2026. We're halfway through 2026. Was that a good idea looking back, like to be 100%. Raising that much money?
Yeah. Yeah. I mean, here's the fascinating part about NexHealth, though, I would say, which is this. Every time we raised capital, we didn't need it specifically because, remember, like we ran out of cash, right, at a certain point. So we had to run cash flow positive by default. And then we raised some capital, right? But that lean efficiency, at least, from my, like culturally speaking, never went away. So we were like roughly break even, for couple, up until I want to say like really 2023, right? But in between that, we raised a total of 176 million. So the question is why, right? And at that time, like there was massive bubble going on at the same time and happening as well, right? However, at that time, I didn't have a ton of VC connections to begin with. I was just like, we were like going from one fire to another fire every 6 months, first, running out of money, and then COVID happens and so on, right? So I didn't really have time for it. All of this to say, so around like mid-2020, what started to happen actually is that we started to experience our very first couple of electronic health record systems starting to try to block our connection with updates. And that made me really panicked in the sense that, we ended 2020 with about 1,000 customers. And I was like, holy shit, if, we're only 1,000 customers and, Henry Schein and like some of these vendors, they own a massive part of the market. And if they block us and we're just going to die. So how do we solve it, right? And what I realized is like the only way to solve this problem is that we have to grow as fast as possible. Meaning like, the earlier concept of like, we have to have a lot of mutual customers with them, right? And then we have to do it so fast that a lot of these companies are, really large, political. By the time they get, their kind of reaction together, like we
got a lot of meetings about the meetings.
Yeah, exactly. We kind of snuck up on them. So that was the goal, by the way. So we went from 1,000 customers to 10,000 by 2023. And the reason we raised was literally just to solve an existential problem with an amazing product and value prop and so on. So we knew it would grow. But for me personally, I was like, if we don't grow, we're going to die. Like, it wasn't even like, oh, you got to grow, you're a startup. It was literally like, if you don't grow fast enough, there are like, 5 different companies trying to kill you at all times.
I mean, it's not even like it's that much capital.
You're right. By today's standard, yes.
Especially today. Like,
yeah. You're right. Yeah.
I mean, that'd be like you could have raised that like, you're like, hey, we're a AI healthcare, and you raised $100 million.
Honestly, yeah. If I just change our domain to like .ai, I bet some random VC will throw like $500 million at us.
their AI sourcing tool will like surface it to investment committee, and they'll.
AI is honestly kind of so fascinating because how do you even differentiate at this point if you're a company, if you're in any sort of like a B2B or even consumer, really?
That's a good question. I mean, I feel like a lot of the way people answer that question is go into the physical world. Like that seems to be the solution to that. It's like, so
is the software category dead? Like, so Claude and OpenAI are the only software companies remaining?
But then at the same time, like, could I just say, hey, Claude, go to nexhealth.com, copy it, come back in a day, make no mistakes, go. Yep. Like, could I do that?
You could do that, yeah. 100%.
Oh, I could do that.
Yeah. Well, it depends. Depends which part. Okay. But you could. So here's the thing, right? Here's actually a really fascinating part about NexHealth. And more recently, I was having this conversation with this, investor. They're not on our cap table. And, we're just joking around like, man, if you were founded before 2022, you're probably pretty screwed right now, right?
Yeah.
Except, honestly, I would say like the fact that NexHealth was founded before 2022 is one of the biggest, like just happenstance kind of strategic advantages we have today.
Really?
Yeah, because like we had enough time to go through all of the pain of like figuring out these integrations, right? To build the infrastructure where now because of AI, I shared earlier, right, within 18 months, the API product grew so quickly, right, from 2024. The reason it grew so quickly, just FYI, is really because of AI. And the reason it's because of AI is that if you're building any sort of an AI agent in our space today, the whole reason you're building AI agents is because, you want to complete tasks, right? Ultimately, that's the value prop, right?
Yep.
You really can't complete tasks unless you can read and write data into those electronic health record systems, be it cloud-based or on-prem. And NexHealth is your only option today because, really, honestly, I don't think, at least not that I know of, like a direct competitor in our specific space from SMB, dental, dermatology, and so on, that has the number of integrations we have, the depth of data that we have, the reliability, and so on. And the fact that you can go and sign up and you can start building for free in itself was a huge unlock for us. And I have also never seen the rate of startups being created in our space.
Really?
It is phenomenal. Like I've never seen that before, ever, honestly.
So what are some of the most interesting startups doing in healthcare right now that you're seeing?
Yeah, so I would say majority of the startups that are building with us first, just to be very, very clear, one way or another has to do with AI these days. Of course, you're building AI products, right?
Yep.
But the really fascinating part though is that, on the SaaS side, right, we have direct competitors that are much bigger than us. So they, compete with us for scheduling, patient communication, and so on. They have very large deals with us to use our API to build AI agents and AI products for, various workflows out there. But anyways, just to answer your question though, what are the more interesting use cases? More and more, what I think, what's happening in our space is this, which is there's a famous chart. I don't know if you've ever seen it, the administrative growth versus physician growth. Yeah. So there's, a massive amount of founders and engineers that are literally all hacking away at that problem.
And this problem is that there's the pace of jobs in administration is growing 5 times faster than the number of people that are delivering care.
Yeah. Basically, I think it's the ratio is something like 50-1, meaning for I could be wrong there, but it's that
for
big of a gap.
For every doctor,
exactly.
person administering care, there's an increasingly larger number of support,
administrators,
administrators around it.
Yep.
Okay.
And these administrators are, by the way, for the example I gave earlier of, someone, it's 2 people's job just to do the billing stuff. Someone has to pick up the phone. Someone has to then negotiate with the insurance carriers and so on. A ton of this work goes into just supporting an office, right? Anyways, so the more interesting ones that I want to say, it's not, that the technology is fancy or anything, but products are being built that you couldn't build before because of, NexHealth's API, but because of AI to overall solve the gap and the overall staffing gap that our these practices have. So about 45% of practices in the country at any given time, just FYI, is missing one critical staff member that they need.
Really? Why don't they just hire someone?
Labor shortage.
Just pay more money. Do they not have more money to pay?
Yeah, I mean, you also have to be trained and so on, right? And I think the latest data is in terms of graduates, it's increased by 20% over the last 5 years or so. But that's also not enough because
attrition.
What was that?
Attrition, people retiring or?
Yeah, so usually if you're, for SMB practices, right, the profile that's usually working there, they're usually being paid hourly. They do consider it a temporary, maybe in a short term, 2-year job. And then they'll move on to something else. And so the attrition rate is pretty high as well. So you have to constantly replace it. So it's a genuine problem for these, practices and these doctors. And at the same time, they can't function without them. So that's the gap that's being filled today throughout our platform. And I think that's really, really interesting.
So where do you think a lot of the value is going to accrue in AI healthcare specifically? I mean, that's probably where you spent the most time. Where do you think are the most valuable places to be building things? Where do you think most of the value is going to accrue?
I can guess, I would say. And of course, I have a thesis and there's a strategy we're chasing here at NexHealth as well, right?
What are you allowed to share about that?
Yeah. Happy to maybe share, right? So overall, in terms of sequencing, right? I think, let's maybe consider the hype cycle, generally speaking, right?
So we're in an AI hype cycle.
Yeah, exactly. And the different parts of the stack that's, in the hype cycle, right? Okay. So first, it was the chip makers, NVIDIA, right?
Oh, yeah.
In the very, very beginning, right? And then, it's OpenAI and Claude, right? The companies that do the R&D, the research to build the actual LLMs, right? And then I think the third wave that hasn't truly come yet, but I think more and more of the ecosystem is realizing, is that the third wave will be the companies and the infrastructure that takes the LLMs and then enables it to actually action stuff in the real world. When you say physical, what I truly mean is the layer that sits in between the physical world and the software world, where these LLMs can then actually go into the physical world and actually action that data. So very basic example that I gave earlier as well, right? If you're a practice today, you can buy a product out there, or maybe you build it yourself, right? That uses OpenAI's API to build you some, website chatbot product, kind of like Intercom. Think about that. There's a bunch of those as well, right?
Is this in healthcare specifically for a practitioner with the patients?
Exactly. And you can go on the website as a patient and you can chat with it about your condition and so on, and it'll recommend you the right provider in the slot, let's say, in that office to book with, right? That chatbot or that LLM, right, needs to connect to the physical world, meaning what room is available, what day at that office. in real time, because this patient is actually talking to that chatbot in real time as well, to then surface to you, hey, here's what's available, and then take your information and then write it back as well, because otherwise, that patient will show up and it will not be on their calendar, right? So anyways, I want to say so in terms of if you just track the hype cycle, chip makers, the companies, that actually build the LLMs, and it's the infrastructure layer that sits between the LLMs and then the real physical world. And of course, NexHealth very squarely sits in that stack, right? And as a result of that, I want to say a couple of fascinating things are happening within just our platform here. One is nearly every AI startup, and I recently went to this conference where I think 9 out of 11 of the vendors there that are showcasing, and they were AI native or built on our API.
Really?
Yeah, and then we have direct SaaS competitors that are building with our API, and almost nearly every SaaS product out there is kind of getting destroyed by AI native products, right?
Really?
Yeah, I mean, in general, by the way, this is not about NexHealth specifically, but I just mean in general, right? If you're a workflow SaaS product, right? I don't know, you're a communication tool for lawyers or something. AI is really eating your lunch today if you don't evolve quickly enough, right?
Yeah.
The really, really fascinating part is when it comes to NexHealth SaaS product, we're actually not facing that pressure at all. And the reason is this, right? So AI doesn't happen in our space today. And this is really not just an exaggeration, but really I truly mean in the sense that we really do own the infrastructure layer today, right? For it. So AI doesn't happen without NexHealth. So all of these companies, if they want to build AI agents, they have to build on our infrastructure, and they know that we own these specific SaaS workflows, right? So they just don't go after it to begin with.
Interesting.
Yeah, because we claim that, right? It would be you're building with OpenAI, but you want to build a chat,
like a chatbot, like ChatGPT.
Yeah, you want to build chat, that would be kind of stupid, right? Yeah. So that's the same effect we're seeing here. So it is all of this to say, I think most of the there will be many, many, many valuable companies, and a lot of the developers that are building with us they have massive potential. Some of them are growing way faster than we are growing, right? But I want to say that where do you differentiate today, right? I think the most highly differentiated companies will be really 3 types of companies. You can differentiate on distribution. Mm-hmm. You can differentiate on infrastructure, so payment processing, or what NexHealth's synchronizer API is. Or you can differentiate on maybe some unique proprietary data. NexHealth has all 3. Distribution. When I say distribution, here's what I mean. Every single time a developer builds any sort of a product on our API, they have to then onboard some practice. If you go to Venmo, you try to connect your bank account, Venmo will have to onboard you to Plaid, literally, right? So they have to do that as well. And that in itself gives us exposure for the SaaS product. And then some practice will discover us from there, sign up for the SaaS product. And then they'll be well, hey, what about my other vendors? Why aren't they using you guys? I wish they could read and write into my system as well. Then those, some developer will sign up. So we're seeing a really fascinating flywheel motion today as we speak.
Oh, where it's a practice will have one of their vendors use NexHealth, and then they'll ask the other vendors, say, hey, you should use NexHealth too.
Exactly. Or they'll actually directly buy our SaaS product and then realize NexHealth is the only vendor that can read and write data. And they'll be they'll reach out to us hey, how come my other vendors can't do this? Basically, right? And then, a lot of the developers that build with us, they also want access to the practices that are on our platform. We, of course, own the infrastructure layer that can read and write data. And then, of course, we have 89 million patients in our database. So we have really all three, data, infrastructure, and the distribution at NexHealth today.
I mean, you probably had to be pretty patient, though, because I'm thinking ChatGPT launched in 2022. Were you just let's just do a bunch of AI stuff? Do we train our own models? What happened after ChatGPT launched? What was that evolution of how you're thinking about the business?
Yeah. So one of the things about NexHealth, as an FYI, we generally like to wait a bit for things to mature before we, start building with it. So when actually ChatGPT first came out, within 3 months, we had 2 AI features built into our SaaS product. And within 6 months, I flew our entire engineering team to Mexico for a 3-day hackathon of just building a bunch of, AI native products and features. And then more recently, by the way, we also did another hackathon where you just build AI products on our own API. So we are very, very early to it, but we actually never truly released anything user-facing
Really?
Yeah.
Why not?
So healthcare is one of those areas where being innovative and being at the cutting edge is really, really important. At the same time, though, it has to be accurate, compliant, and it has to work. Meaning, at that time, I personally didn't think the models were mature enough to be able to support the types of use cases that our customers would want to use us for.
So they would like hallucinate some customer data and mess something up.
Yeah, like imagine you're I think you have like 3 kids, I believe, right?
Only 2.
Only 2. Okay, got it.
So some days I wish I had 3. Some days I'm like, I'm just so glad I only have 2.
Imagine some like AI messes up, I don't know, like one of their appointments or something, right?
Yeah.
And then you're a busy father or mother, right?
Yeah.
You'd be pretty pissed. Like that is what actually often happens with a lot of the AI vendors in our space, right?
Really.
So it's really, really important that the model is mature enough. And at the same time, though, really like what we've waited for up until now is not only the models are mature enough, but releasing a version of our API, what we call like an intent-based API. You can think about it as basically our own API that replicates what traditionally in AI-based products you would call tools or like workflows. As in we have 98 total endpoints, right? We can, as a developer, you can like weave them together and build workflows. Versus we released a new version a couple of weeks ago where all of those workflows are pre-built for you, so that whatever LLM product you're building, right, can just simply call those pre-built workflows and get going, right? So first is we wanted to actually take the infrastructure approach here first, and then release practice-facing products. And we're going to have practice-facing products coming soon as well.
Oh, really?
Yep.
Okay. How do you think about like you have competitors that are building on your API?
Mm-hmm.
That's a pretty sensitive thing to navigate.
Mm-hmm.
Like, I mean, just how do you generally approach that? Because someone might say, like, why would I build on my competitor software? Like, people make the same argument with OpenAI. Like, they'll just steal the best products and ideas. Like, how do you navigate that?
I mean, honestly, from my seat, it's not like we're forcing anybody, right? We have a really valuable product, right? And the market trusts us enough, right, that they're doing it. So in terms of like how do you navigate that, I don't really think about navigating it. Frankly, they're a partner, they're a customer. We'll give them a great service, and we'll build a great product for them, and we'll enable them to innovate, right? Ultimately, that's our value prop. And then when it comes to competitive areas, sure, let the best product win, but we're not going to, for us, they're just as important of a customer and partner as anybody else.
Yeah.
And our, kind of, what NexHealth is, we're a platform, right? And our mission statement is to accelerate innovation in healthcare. And what we do not want to become is Henry Schein, right? Where we treat different vendors specially, or like, we play favoritism. None of it matters. Like if we're truly, sticking to and being honest with our mission statement, right? I think, the technology we have is amazing. It took us a while to build it. It was really hard, but I think we have something magical here, right? And using it like as a hammer or like a tool to manipulate product quality or the market and so on, just like the incumbents do today, where they are the gatekeeper, right, to innovation, will just go against our mission, right? So from a cultural principle standpoint, we tend to be very, very neutral there. And then it shows up in the market because these, competitor, these very large companies, by the way, some of them are public, that are competitors of ours on the SaaS side. Their CEOs, trust us enough that, they stake their entire business on our infrastructure. And overall, we tend to have a great relationship. And generally what ends up happening though, like I gave that earlier example, right? We do have our own lanes, like everyone differentiates in some way, right? And because, we're the platform, right? It would just not make sense to go straight for the SaaS product and the core value prop that we have. And, there's like plenty of ways to differentiate and like go after workflows. And the market is large enough. So more organically, competitors end up just like kind of staying away from our core lane anyways over time.
So it's really like the whole OpenAI and ChatGPT thing from earlier.
Yep,
yeah,
exactly.
And so you don't really think of yourself as a healthcare company. You guys specifically say we're a technology company. Like, why is that so important to how you guys think about things?
Yeah. So earlier, we had talked about why did it work with NexHealth versus like every other startup that tried before this, right?
Yep.
One of the core things I realized, maybe like around 2022 or so, is that what did everyone else do before us? And like that was different. It was all relationship based. Like as in, hey, we're going to go sign partnerships, have good relationships with you, and that's how we're going to solve this problem, right? Versus we took a pure technology approach. We said, hey, this is a technology problem. We're going to build some unique technology that can sync data back and forth, make it reliable, stable enough, and scalable enough that you can, build these like massively scale, from Invisalign to and so on, right? Like these massively scalable products on top of this infrastructure, right? Anyways, all of this to say, so healthcare and more generally, I want to say, like, nearly every space, right? Taking the approach of technology and like just building great technology and great products is the way to change healthcare versus anything else. And it's really, really important, like for us to differentiate that way, because I think majority of companies, even if they're tech companies in our space, you'll notice culturally to the way that they describe themselves and so on, they will say, hey, we're a healthcare company. And that has a ton of consequences because the way you approach problems is different now. So really, again, example of, do you partner with these EHR systems? Do you pay them 30% or not? Or do you just treat it as a technology problem and solve it with technology, right? Depending on how you think about yourself, you would make a different decision, right? So it may not feel that important, frankly, from the outside, but at least in the world of healthcare, and especially internally, I really, really, like every couple of months in all hands, I emphasize it like, hey, we're a technology company that just happens to be in healthcare, solving problems, right? And I think, that if we continue that approach, I think we will continue to succeed as a company. Yeah.
And like you don't really hire from the healthcare industry. Like most of the people at NexHealth, their background is in technology.
Yep.
Like they worked at Netflix or Databricks. And so that feels pretty important to them of like keeping that ethos.
Yes.
And how do you convince people to then come join? Like what's generally like the pitch for like joining NexHealth versus, could go work at Anthropic right now. Maybe they could, but I mean, I guess only a couple thousand people can. But like, why is NexHealth like? What's the pitch like? Convince people to come work there?
Yeah, I think there's twofold, right? Like one is we have a great mission, right? In addition to that, like NexHealth is really, I want to say, for a very like specific type of person and a specific type of culture as well, where not everyone is the right fit for us. To be very clear here, right?
So who's a bad fit? Or who's a good fit?
Okay, just to be blunt here, I would say like, a bad fit would be someone that would join OpenAI today or Anthropic today.
Really?
Yeah. So NexHealth is for the type of person that genuinely wants to have real impact on the world, that genuinely, wants to do good for the world, like more directly, right? But then also so ambitious, right? That they want to, build something that will outlast OpenAI or any other software vendor I can think of. And here's what I mean, right? Healthcare and the lack of innovation and this like problem statement, right, is a type of problem that every single human before us has had, like healthcare problems in general, right? And every single human after us will have. So it's really a species level problem. And like, the ambition that we have here, right? Building the infrastructure where innovation happens. If we can unlock that, right, I think, we've changed the course of humanity in a sense versus anything else, frankly. And healthcare is so personal. Yeah, money is important, work is important, productivity tools are important. All of it is really, really important, right? But, the one area where I think it matters the most, everyone's health, really. If you can impact that and you can build, at the same time, scale it globally and build something valuable, institutionalize it, meaning a company that's generational, right? Like that is our ambition here. If you can do that, then, I think what I like to call, you'll be a legend, basically. What's
the importance of shoes at NexHealth?
Oof, yeah. So I want to say like it's a symbol of being scrappy, basically. So this actually comes from, you'll recall that I hired this college kid, Bobby, basically to be an SDR. It was his first job.
The first one?
Yeah, like first job ever, or one of our very first hires at NexHealth on the sales side. So at that time, I was closing all of our deals. And then I was like, all right, maybe let me hire someone that can create pipeline for me. And of course, he was ambitious. And within like 3-4 months, he wanted to start closing his own deals. Anyways, all this to say, so at that time, I was like, you know what? How about this? As soon as you close your first, deal, I'll, get you a gift, basically. And he did. And I walked over to the Allbirds store and spent like $60, I think, on a pair of Allbirds and brought it back to him and gave it to him as a gift. And since that's a tradition that has continued at NexHealth, which is, when you achieve a milestone or like the first milestone, everyone just gets shoes, basically.
Was he literally walking around closing the deals? Like when he was the BDR back in New York?
Yeah, let me think. I think by that point, honestly, it was like 50-50.
Okay.
Because I was like, all right, maybe you don't have to go into the office, right?
Yeah.
But anyways, it was 50-50. But at that time, man, we were doing anything and everything. Like I would drive like 2 hours to go to an office sometimes.
Oh, yeah. I mean, you were in Detroit, I guess, for one of those big customers too. And you guys, I think you like don't use Slack as much as like the average startup. Like you're very like you do a lot more emails.
Oh,
it's much more structured in that way, or
okay. So that's my desire.
Oh, okay.
as a CEO, but that is not true. Honestly,
it's not true. Okay.
Yeah. Like Slack is just messy. Like I don't like it. Honestly, like company coordination, internal communication, from the tools to how do you effectively coordinate a set of people cross-functionally and then execute. And then when you're doing the execution right. It's generally something, whatever we do is usually something new. Maybe it's been tried in other spaces, but hasn't been tried in our space. Great example is the payments product, right? Like you'd think, Square can actually knows, hey, who paid this bill, right? Those basics don't exist, right? So we do have to like invent new concepts in our space, right?
Yep.
So I think like, one of the reasons you see me complain about like sometimes just internal communication tools in general is that coordination and speed internally is just so important, especially when a lot of the people that we have come from outside of tech. And on top of that, it's a problem we're addressing that no one else usually has solved yet. And it's a new thing for the market. A lot of things just have to go right, honestly. Like execution at NexHealth is really hard, but really important.
How have you, are there things inside the company you've changed because of AI?
I think the obvious one is, I think something like 100% of our code is written by Claude these days, right? Here's I would say like, kind of, I want to say a change, at least for me in my thinking. And it's kind of, it's taken a bit of adjustment in two areas. One is because of, how advanced, like Fable, right? Like Fable 5 is just freaking amazing, right? Because of, how mature these models have gone, you can genuinely say, hey, this is, Fable 5 is probably like, I don't know, like a close to a staff level engineer today, or maybe, or will be very soon, right? So what does that mean, if you now take that same sort of like skill set, right, and take it to marketing, legal, and so on, right? I don't think it necessarily means you hire fewer people, or like, I don't think that's the right way to think about it. But I think the way you get work done, though, is fundamentally changes. And if you don't change the way, internally as a company and your teams are working, you'll be left behind and someone else will just outcompete you really, really easily. I think most people look at it from the lens of like, hey, it's about the number of people, right? And that's like the ultimate end outcome. Honestly, I don't think in reality that's what's going to end up happening. I think what's going to end up happening is you'll generally probably have the same number of people, but the same number of people now are getting things done at like 5x the speed and maybe 10x the output. No company in the world will say no to that, right? So like that'll, I think, continue to happen. And I think that is what's happening at NexHealth as well. Like to the point that our marketing team, I am not even kidding, like, just a random problem we're having more recently internally the last couple of weeks. Our marketing calendar for product releases doesn't work anymore because there's just so many things there to ship.
Oh,
yeah.
Okay.
Yeah.
What's the, when you look at like the line item, like cost, expenses in the budget, like what are the biggest AI tools you guys are spending on?
So so OpenAI, actually we're on both, like we're sort of model agnostic in a sense, but different use cases, right? So for product facing, we use OpenAI. For internal, Claude, but and Gemini as well. Anyways, so our, Rami, our VP of engineering, he spent his early Google, spent 20 years there, then Databricks, and he's also PhD in machine learning. So he has a lot of opinions on these things and a lot of expertise as well. And also, understands obviously all of the pitfalls as well. So we tend to use all three, but it all depends on the team. And I think it's important that any company honestly remains model agnostic.
One last question: do you have a favorite founder, CEO, or business just from history that you've gotten a lot of inspiration from?
So this is going to be, I think, for a lot of people, it's surprising, but for me, frankly, it's Microsoft. And the reason it's Microsoft is this, which is, Microsoft was one of the very first companies out there to scale and really invent the business of software. So before Microsoft, just as an FYI, software culturally was expected to be free. Like you
really,
yeah, you paid and you charged for hardware, but the software was a hobbyist thing. It was always free or just by default. It's not that valuable, basically.
But it all kind of sucked, right? Like it was. I mean, compared to today.
I mean, yeah, computers sucked back then too, technically speaking, right?
Fair.
But anyways, Bill Gates was the very, very first one to start monetizing software, and everyone kind of hated him from that point onwards.
Really?
But the reason I admire the Microsoft story specifically is that at NexHealth, I feel like, we're really, honestly, like it truly does feel like we're doing something very similar in the sense that when I say, we're really inventing a lot of new concepts and like really new products, new ways of doing things, and like also fighting a ton of inertia, right? And creating this like ecosystem for innovation as well on top. The best company I can think about from a business model perspective, to the number of products, to the strategy, and like really everything, I would say like Microsoft 1990s is the best comparison. I'm also a huge history nerd. And yeah, Microsoft, I want to say 77 to 1990 would probably be my like biggest inspiration.
Really?
Yeah.
Do you have any favorite like people from history? I mean, this could even be like 10,000 years ago. Like, I don't know, Caesar, Cleopatra. Like, I just know George Washington. Like, anyone interesting?
Yeah, that's a good question.
The thing that I always am pretty fascinated by is like you'll read this story of like, the American Revolution. Like we just randomly were like, hey, let's like break away from the British and like we like won a war. But it had to do with like there's like a business commercial reason for it. Like we didn't just wake up and say like, hey, let's like secede from like the colonies are just going to break away. It's like there was like incentives and there's like a whole business behind it. There's a pretty interesting actually podcast I listened to. My friend Ty Morse has a podcast called Relentless, and he talked to Ryan Peterson, the founder of Flexport. It was 45 minutes of just talking about like the history of logistics. And it was fascinating that every single like big historical event that you think of was related to like some kind of logistical problem.
Very true.
Like how global trade evolved and like the economy evolved around how like a new technology enabled like a boat to go farther or like a wheel enabled like the trade route to be longer or like the like planes enable trade in different ways. So I'm always fascinated like with history of like how these like non-obvious types of things really impact stuff.
Yeah, no, actually, I mean, like all of history just as it like is driven by trade. Like really all of it is driven by trade. Trade routes, ability to trade, and like really money movement in a sense, like where does the money go? Basically goods. So like, here's the thing though, like I am a history nerd and like, over time I sort of like have evolved my points of views on a lot of different things.
Really?
One is the admiration of just like great men in a sense. And like, I'm not one of those, people that don't believe, history is not driven by, great historical figures. I think there's much more nuance than that. But at the same time, though, honestly, like what I more so admire are the structures, the institutions, as well as the conditions that exist to like drive some change, and the people that saw that opportunity, took advantage of it, and then drove that change essentially.
Wow, this has been a lot of fun. Thanks for coming on the show.
Yeah, of course. Thank you for having me as well. Honestly, a really fun conversation here.
And I hope you had fun. Thanks again to this episode's sponsors, Flex, Numeral, Amplitude, Merge, and Monaco. If you enjoyed this, please like, comment, subscribe, and share it with a friend who should be using NexHealth. Make sure to check out the back catalog of over 100 episodes with investors like Gary Tan, Elad Gil, Chetan Nayak at Benchmark, and the founders of companies like Robinhood, Sweetgreen, and Mercury. Tune in over the next few weeks for conversations with Naveen Chadha at Mayfield, Michael Tannenbaum, the CEO of Figure, the first blockchain-based lending company, and my friend Shensi Ding at Merge. If you don't want to miss any of these, subscribe to my newsletter, The Split, linked in the description. Get each episode plus a transcript emailed directly to your inbox every week. Thanks again for listening. See you next time.